Thank you, Mr. Speaker. If you listen to America's senior citizens and ask them what they want with respect to Medicare, I think this is what you hear. Seniors want to continue to have their benefits left alone and to be able to choose the doctor and hospital they want. Under our plan, they do. Seniors want to pay less for their prescription drugs, which are rising at a rapid pace. Under our plan, they will. Seniors want to be sure that their doctors will continue to provide the quality care for them because they trust and rely on those doctors so much. Under our bill, doctors will get more of what they richly and fairly deserve. They'll get paid what they deserve. Now, the other side has engaged in a scare campaign to scare America's seniors. I think what most scares America's seniors is the irresponsibility of proposing nothing about America's health care crisis. That's what the minority offers. We offer a better way, a brighter way, and a safer way for America's seniors. I yield.
Some of our friends on the other side of the aisle is that there's some massive health bill that's being cooked up in secret, that they are being denied knowledge. They don't know what's going on. Mr. Speaker, everybody on Capitol Hill who wants to know can find out what is in the legislation. They can not just go online, but the news accounts, television shows, trade publications. In fact, yesterday in the Wall Street Journal, it was outlined again. There are, agreed, some sticking points yet to be resolved. But those are being debated. They're public. People know about the public option. Indeed, the notion that somehow we could keep a secret on our little village of 5,000 compulsive leakers is laughable. Everybody knows that to be the case. But if they were still confused, they could have just listened to some of their colleagues who were talking about how they disagreed what was in the bill. They should talk to each other.
Time's expired.
At the end of President Bush's term, this House was faced with the TARP bill. And the American public likes bipartisanship, and we had bipartisanship on that bill. There were Democrats and Republicans who voted no, but there were Democrats and Republicans who voted yes. And just about everybody agrees that bill saved us from going over the precipice, over the abyss, into a Great Depression similar to 1933. It was a moment of bipartisanship and a moment I was proud to participate in. When President Obama became president, bipartisanship ended. The ARRA, which everybody agrees the stimulus package has helped our economy and provided millions of jobs in state and local government and education and other places and provided jobs in the private sector, didn't have a single vote on the Republican side, not one single vote. And now on health care, we see not one single vote coming from the Republican side. Doing nothing is not the answer. Everybody knows the health system needs reform. In my city, our emergency room at the Charity Hospital, the public hospital, is about to close. People are having great problems paying their premiums. We need health reform and we need bipartisanship. Thank you, Mr. Speaker.
Mr. Speaker, I rise today in strong support of national comprehensive health care reform for all Americans. Our district has the highest number of uninsured adults in the nation. Since 1965, Medicare has proven to be one of the great success stories of the federal government. It is the second most popular government-run program behind Social Security. That's why I strongly support national health care reform that includes the national public option similar to Medicare. Some of our Republican colleagues have been quick to say that H.R. 3200, America's Affordable Health Care Choices Act, endanger traditional Medicare and eliminate the Medicare Advantage program. These assertions are not true. The fact are that H.R. 3200 does not use funds from Medicare Trust Fund to pay for reform. Instead, it eliminates waste and fraud within the Medicare program, abolishes the infamous donut hole that was created under a Republican Congress in 2003 on the prescription drug plan to strengthen the financial health of Medicare. In 2003, a Republican Congress created the Medicare Advantage program, and insurance companies have been benefiting ever since.
Gentleman's time's
reimbursed
expired.
More than regular Medicare. We need to change it.
Gentleman's time's expired.
Thank you, Mr. Speaker. We are entering the final stages of crafting a health care bill that gives the American people what they want: more choice in health care options, lower cost for families and small businesses, and insurance that's fair to American families once again. And we've worked long days and nights here in Washington to craft a bill that addresses the challenges that people in Connecticut and across this country face. And the American people have been able to read our bills and monitor the debate on television and on the internet and be able to interact with us when we come back home. Meanwhile, where have our Republican colleagues been? Sitting on the sidelines, talking about solutions, but sharing nothing with the public. And they've kept us waiting for the last 133 days without a bill. Well, it's time for Republicans to get in the game, because health care struggles of the American people aren't getting any easier, and they can't afford to wait. I yield back.
Central to finding a uniquely American solution to our nation's healthcare challenges is a focus on strengthening Medicare for our nation's seniors. Our healthcare reform efforts renew our commitment to the health and security of America's seniors by ensuring the long-term fiscal health of Medicare and improving the quality of care for our seniors. The House bill adds valuable new benefits for our seniors and improves access to primary care. I strongly advocated for ending the copayment that seniors pay for prevention services. Right now, seniors pay up to 20% on the cost of services such as mammograms and colonoscopies and vaccines. As of January 1st, 2011, seniors will no longer have to pay the copay for preventive services. This is a major win for America's seniors. And healthcare reform also sets us on a path to close the coverage gap for Medicare Part D prescription drug plan known as the donut hole. In 2011, Medicare will pay $500 more and will continue to add benefits until we eliminate this gap in coverage for drug services. Healthcare reform is a win for seniors. Now is the time to act.
Mr. Speaker, the American people elect us to serve as innovators and problem solvers. I am an engineer. I see a problem and I come up with a solution. The Democratic Party is a party of solutions, especially when it comes to health insurance reform. So I ask you today, Mr. Speaker, where are the Republican solutions? 133 days ago, my friends from the Republican side of the aisle said they were going to have a comprehensive plan. Where is that plan? And just what are those solutions? Democrats have already pledged to make the merged health reform bill public for 72 hours before it's considered on the floor. Will Republicans promise to do the same? Given the status quo of health insurance coverage in the United States, it would appear as if Republicans want to continue to deny coverage for pre-existing conditions, force families into bankruptcy because of health care costs, stifle the growth of business, and continue to play politics as usual by defending insurance companies and pharmaceutical companies. Then they should also be happy to be labeled the party of no. Thank you, Mr. Speaker. I yield back the balance of my time.
Gentlemen. Thank you, Mr. Speaker. Mr. Speaker, it has been 133 days since the Republicans promised to present their health insurance reform legislation, and we still have no alternative plan for them. The fastest growing group of uninsured Americans is older Americans aged 50 to 64. Saying no to health insurance reform hurts millions of Americans who lack health insurance. There was a 36% increase in the number of older Americans without insurance from 2000 to 2009. It used to be if you worked most of your life here in America, you could retire to someplace warm and sunny like my home state of Florida. There were 7.1 million uninsured people aged 50 to 64 in 2007. How can we allow more than 7 million Americans over 50, many who've worked their entire life, to go without health insurance? They certainly can't afford to retire when they're worried about how to pay for their medical bills. Republicans point to a bunch of different solutions offered by their members, including dismantling or privatizing Medicare. So which plan do they stand behind? Americans deserve to know. Thank you. I yield back the balance of my time.
Thank you, Mr. Speaker. This Congress is doing health insurance reform this fall. What does that mean for middle-income Americans? It means an insurance company can no longer decide to deny you coverage because of a pre-existing condition or jack up your rates because of a pre-existing conditions. It means it will be against the law for insurance companies to drop your coverage when you become sick. It means insurance companies will no longer be able to place an arbitrary cap on the amount of coverage that you receive. It means there will be a yearly limit on how much you can be charged for out-of-pocket expenses, because no one should go bankrupt because they get sick. It means 35 to 40 million additional Americans will be covered with health insurance. That's virtually every legal resident of America. This set of health insurance reforms means that America will finally get the health care coverage that it deserves.
Mr. Speaker, Democratic leadership is committed to making any health care reform bill available to the public for at least 72 hours before a floor vote, and I'm glad they have, because the American people deserve a chance to see what we are doing. But there's one group that has made it clear they don't need 72 hours to decide where they stand on health care. It's our Republican colleagues. We could give them 72 days, and they would still know that they're going to say no on no matter what is in that bill. They don't need time to read our bill to know they are against giving affordable, quality health care to every American. Truth is, the Republicans haven't given us 1 minute to read their bill. You know why? They don't have a bill. It's been 133 days since Republican leadership promised a bill from their side, and all we hear is no. And now some members of the party, their party, are giving us ideas like privatizing Medicare and increased subsidies to insurance companies. Mr. Speaker, the American people know it's time for reform, and it's time the members of this House stand up for them and give American people the health care they deserve.
Time's expired.
I yield back.